Welcome to the Dr. Carolyn Coker-Ross Show, awakening your full potential and expanding your understanding of how to live fully and joyfully by making conscious choices that promote and maintain vitality in all areas of your life. Now here's your host, Dr. Carolyn Coker-Ross. Please be sure to listen to this episode in an environment that is safe. Do not listen to this recording while driving a car or operating any kind of machinery.
Welcome to the Vital Life Radio. Today my special guest is Dr. Sanford Newmark, and we're going to be talking about how to treat ADHD without drugs. Dr. Newmark is a clinical professor in the Department of Pediatrics at the University of California. He is head of the Pediatric Integrative Neurodevelopmental Program at the Osher Center for Integrative Medicine, specializing in the treatment of autism, ADHD, and other developmental or chronic childhood conditions. He graduated from the University of Arizona College of Medicine and did his pediatric residency also at the same place. After practicing general pediatrics in Tucson for 12 years, he completed the fellowship in integrative medicine with Dr. Andrew Weil's program at the University of Arizona. Welcome to the show, Dr. Newmark. Thanks for being here.
Well, I'm delighted to be here. Thank you.
So you wrote a book that just came out this year called ADHD Without Drugs, A Guide to the Natural Care of Children with ADHD. And it's a wonderful book, giving a totally different perspective on ADHD, which is essentially dominated by the use of medications in treating children.
It is. So, that's part of why I wrote the book, because I was concerned about the dominance of medications, although I'm not against using medications in ADHD in certain circumstances. I don't think that should be where we look first.
And it seems to be the case. Is it my imagination, or over the past decade have there been an increasing number of children being diagnosed with ADHD?
Oh, it's not your imagination at all. And it's not just the past decade, it's the past 30 to 40 years. In 1970, there were 150,000 people using stimulants, and in 2003, there were 2.5 million. And
oh, my.
Right now,
that's a huge increase.
Yeah. And the number of children diagnosed right now is around 9% of all children. So almost 1 in every 10 children has received a diagnosis of ADHD, which makes it tied with asthma for the most prevalent disease of childhood.
Amazing. Well, how can you explain this, massive increase?
Well, it's a really interesting topic. There's really a few possible reasons. One, maybe these children all had ADHD and we never found them. Mm-hmm. Two, maybe we've just loosened the definition, or we may be just misdiagnosing people for a number of reasons. And then the final thing, there may be reasons to think there are more kids who actually do have ADHD. And I think there's some truth in all of those. So I think it's a combination.
So is our incidence of ADHD in children the same as other developed countries across the world, like England or France or Germany?
It's really interesting. If you look at the number of kids who are diagnosed and treated, we're by far and away the most. Ours is way more. If you do studies and you go to other countries and you sort of ask whether kids fulfill the criteria for ADHD, then other studies sort of show that it's similar. But it's a question of how the culture looks at these kind of symptoms and what they decide to do about it, if anything.
So what you're saying is they may see the same kind of picture in children, but they don't necessarily label them as having ADHD or treat them in that way?
Exactly. The rate of Ritalin use in the Ritalin or other stimulants like Ritalin in the United States is way, way higher than anywhere else.
Mm-hmm. So what is research showing us about the essential causes behind ADHD? I know in your book you write quite a lot about some of the the studies of brain scans that are showing differences in the brains of children with ADHD, and also differences in the kind of feel-good chemicals that our brains make. Can you say a little bit about that?
Yeah, I can. So basically, there's been a lot of, as you say, brain scans and other investigations to try and figure out what's actually going on with ADHD. And although the studies vary in what they find, the thing that seems to be most prominent is that the frontal lobe of the brain seems to be less well developed, seems to work less well, and that's the part of the brain that essentially is responsible for what we call executive function. That's like the part of the brain that's kind of putting a brake on things. That's the big decider of how we react to things. And the frontal lobe is responsible for that. So when sort of something happens and we react, usually the frontal lobe is there to kind of put a brake on it and say, well, how should we react, and should we react? And that is, relatively undeveloped, say, in 3-year-olds. Nobody's frontal lobe is very well developed. 3-year-olds just sort of something happens, they react. And as we get older, that frontal lobe develops more and more. And in people with ADHD, children with ADHD, it develops more slowly. And
so it could explain why children with ADHD have poor impulse control?
Absolutely. That's why they have poor impulse control and why they're distractible. And even why they're hyperactive sometimes. Although, of course, now a lot of children who are labeled with ADHD aren't hyperactive. And there's also changes in the sort of circuits of the brain, how that frontal lobe is sending messages to various other parts of the brain. So that's sort of the most basic thing. And then in terms
of... Is that a permanent difference, or is it just a developmental delay?
Some studies have shown that these kids catch up, that their frontal lobe actually catches up, but other studies show that that even adults with ADHD may have similar changes. So,
is it possible there's a subsegment of people who, just genetically are hardwired that way, and then there's another segment who may just be slower in developing and in that way, and may catch up later?
Exactly, that's exactly right. And we don't know what makes people catch up or not, or what makes one subset different than another. Maybe in the end it'll turn out to be genetic, but environment plays a huge role. That's another thing about ADHD when you're asked about what causes it. We know it runs very strongly in families. So it's most of the time when I see a child with ADHD, either mom or dad or an uncle has similar symptoms, even if they weren't diagnosed. So there's a strong genetic tendency, but how that's expressed, to what degree the child has ADHD seems to be dependent on environmental influences. So it's not just genetics.
When you say environmental influences, what kinds of things in the environment can predispose or trigger ADHD?
Well, actually, everything from the time the child is conceived on, we believe that, for instance, toxins in the pre- and postnatal environment can do it. As an example of that, children who are exposed to prenatal tobacco use by their moms had 2.5 times as high a risk of having ADHD.
Oh my!
Children, it's higher 4 times higher with children with high blood levels. It's higher with kids who are exposed to certain pollutants.
So toxins, even before a child is born, can influence this. And then after birth, what are some of the environmental influences?
Well, again, some of the things like toxins and pesticides. One study showed that children who had higher levels of pesticides in their urine, meaning that they were ongoingly taking in pesticides, had twice the odds of having ADHD as kids who had the lower levels of pesticides in the urine. So ongoing exposure to toxins actually increases your chance of having ADHD.
Huh. Very interesting.
Probably it's going to turn out to be a great variety of toxins, but we don't really know. One study that's very, very kind of scary showed that they took the umbilical cord blood of 10 newborns scattered around the country, and this is the blood, this is what they're bathed in before they even take a breath the first 9 months of life. And they detected an average of 200 industrial chemicals and pollutants.
Oh, my goodness.
And out of those, 217 are known to be toxic to the brain and nervous system at some level. So some of these were at extremely low levels, but when you combine them all, nobody has any idea how much it takes to affect the developing brain.
So I'm assuming that we have more exposure to these toxins now than maybe 50 years ago?
Oh, absolutely, yeah. The number of chemicals has just increased dramatically, except for lead. Lead we've actually gotten to decrease in the environment.
So that's one benefit.
One benefit.
Step up in the right direction.
That's right.
Well, we just have a couple minutes before our first break, but I like a quote in your book where you say, a trial of Ritalin is not an adequate substitute for a thorough diagnostic evaluation. And when we come back from the break, I'd like to talk a little bit in detail about how you go about diagnosing a child with ADHD. But why do you say this, the trial of Ritalin is not an adequate substitute?
Because Ritalin can cover up a lot of other issues and problems, and in fact, anybody who takes Ritalin is going to concentrate better and be less distracted. That's the big secret, is it actually works on everybody. So just the fact that a child who is given Ritalin may concentrate better or be less distractible doesn't mean that he has ADHD. Okay.
So, but it seems that many physicians are using that as a way of determining whether someone really does have ADHD.
That's exactly right, and I'm very against that type of approach.
Mm-hmm. I'm here with my guest, Dr. Sanford Newmark, the author of the book ADHD Without Drugs, and we're talking about a more integrative approach to the treatment of ADHD. And before the break, we were talking a little bit about environmental factors that can influence or trigger the development of ADHD, and I think you had one more that you wanted to mention.
Yes, I wanted to mention that television is another factor that research has shown can increase the risk of having ADHD. At first, a few studies showed a correlation between television watching and ADHD, but nobody was sure if that was because children with ADHD watched more television or television was causing people to be more ADHD-ish. But a recent study actually confirmed that it looks like television and by implication video games and other electronic media can actually increase the risk of having or ADHD or of ADHD being worse. So that's another significant environmental factor.
Is there a break-off point where TV watching is too much, or is there any safe level of TV watching or video game playing?
There probably is, but we don't know it. I really advise people to limit screen time to half an hour to an hour on school days and maybe a little more on weekends. I think any more than that's too much. But we don't really have the research to pick a number.
Yeah, and seems to be a real tough one for parents to enforce, because in our culture it's so natural for kids to, nowadays anyway, to be sitting in front of the TV all day.
It is, and TV, the length of camera shot, in other words, how long the camera stays still on one thing, has dramatically decreased over the last decades. So where you used to be watching television and, you'd be seeing one scene, think Mr. Rogers, Mr. Rogers would be talking. Captain Kangaroo. Then you move to Sesame Street, then you move to the MTV Video style, and now kids are getting flashing images changing every second or two or three. It's really easy to see how that would make them have a difficult time focusing or concentrating for longer periods of time.
Yeah, and then they go from watching TV to going into a classroom where things don't move fast at all.
Exactly.
Yeah.
I really feel for teachers trying to keep kids' attention these days.
Yeah. Well, I wanted to ask you how you go about diagnosing a child with ADHD, because I have so many of my patients who are parents, and they come back and say, well, the teacher told me that my kid has ADHD because he won't sit still in class, or he's talking too much, or, some other reason. So what should parents know about what it takes to diagnose ADHD?
Really good question. So the first thing they should know is that this is a process that takes time, and it takes somebody who's really knows the field and is dedicated to it. And this could be a pediatrician or family practice doctor or a developmental pediatrician. Sometimes a psychologist is very important. But it has to be somebody who really is interested and knows the field and will take enough time. My evaluation for ADHD usually takes 2 to 2.5 hours, which is, in my practice, is split over 2 sessions, because I need to talk to the parents in depth. I get a complete medical history, a complete developmental history. I need to, when the child is old enough, especially any school-age child, I talk to the child alone. I talk to the parents without the child there. And then you have standardized questionnaires are an important part of it. There's these sort of checklists that parents and teachers can fill out. That's a part of the exam, but not the whole thing. I like to speak to teachers or anybody who's done evaluations, or at least like if they've had a psychological evaluation, read that, take a look at it. So all of that needs to be done before you can really make a good diagnosis. Yeah. On the other hand, the way it very often works is how you described it. A teacher or somebody else, sometimes it's the parents, will say, I think he has ADHD, and parents will go into their pediatrician and they'll talk for 10 minutes, and the pediatrician will give them a couple of forms to fill out, and then they'll come back with the forms. Teacher fills out one, parents fill out one, and the teacher, and he says, these forms are positive, so he has ADHD. And then they'll do a trial.
That's trying him on Ritalin.
Exactly, and that's often the whole workup. And that it's not just me who says that's inadequate. Even the American Academy of Pediatrics says that's inadequate. They say it should be an hour or 2 evaluation with the things that I mentioned. But, in the real world, that often doesn't happen. Yeah,
it seems also that there's a desire to, I know that teachers are beleaguered, but there also seems to be a desire to make the teacher's life easier. If we can just get this kid to calm down, then, school will be easier for them.
That happens in a lot of cases. And
or parents.
Yeah. I have great respect for teachers, and I know what they're dealing with these days, especially with the No Child Left Behind and teaching to tests. And many teachers are very, very good about not suggesting the diagnosis too early, but some teachers do, immediately go there because it just makes their life a lot easier. And, they think it'll be better for the child. Mm-hmm. But what that brief diagnosis can miss, that is the problem. When you're doing this in 10 or 20 minutes, you may miss a child with learning disabilities. And learning disabilities, like dyslexia, some people think of it, are very different from ADHD. And if you just treat the ADHD, you really miss the problem. Kids who are anxious or even depressed can look like they have ADHD. A bored, gifted child. I've had kids in my practice who were just flat out bored, and they started fooling around, not paying any attention, didn't bother to do the work because it was too easy. And you get them in the right classroom, and suddenly the ADHD symptoms are gone.
Yeah, I think that's really important, because not every child belongs in a large, public school setting, and some children belong in art school, or more creative settings. So
right.
I think that's important for people to know, that it really should take time to diagnose. I want to move on and talk about. You have quite a lot of excellent information about nutrition in your book, and there's a quote, there's a story there about a school that did an experiment, and this school was in Wisconsin,
Yeah.
And I know in your book you say good nutrition is especially important for children with ADHD. Maybe you can tell us a little bit about that experiment that was done, or the research study.
Right. It was there's a place called Appleton Central High School, which was Central Alternative Charter High School, which was in Wisconsin. And this was a place for kids who were really having a hard time. They were described as disruptive, truant. They had psychological and emotional problems. They came from dysfunctional home environments. It was that kind of a school. They had really big issues. And what happened is the school just decided to take out all the vending machines that had any kind of junk food in it, the soda, the chips, all that. And they got a company called Natural Ovens to begin a healthful meal program for breakfast and lunch. Fortunately, these kids all ate breakfast there, so we were able to change their breakfast and lunch. And so that's what they served. With breakfast and lunch, they served this really good, healthful food, and they got rid of the junk food. And the change in the school and the students was just remarkable. I'll just quote you what the principal says. I can say without hesitation that it's changed my job as a principal. Since we've started this program, I have 0 weapons on campus, 0 expulsions from the school, 0 premature deaths or suicide, 0 drugs or alcohol on campus. These are major statistics. Now, you can imagine what kind of school this was if these are the things.
If they were tracking suicides and deaths, yeah.
Yeah.
And you kind of skipped over that, but what you're saying is changing their diet, only 2 meals a day, drop their rates of deaths and suicide. I mean, that's huge.
Yep. Other comments from teachers: students disrupt the behavior and health complaints diminish substantially. They seem better able to concentrate. They are more attentive. Even the students, there's a wonderful video if anybody's interested. If you Google Appleton Central High School, you will find it online. It's like an old videotape, and it has lots of comments from the students and faculty, and it's really quite remarkable. So when you can make that kind of a change in kids who had those kind of difficulties, I think it really tells you a lot.
It certainly does. We have a couple minutes before break. Can you tell us a little bit about what kind of nutritional changes kids with ADHD tend to respond to?
Yes, and so I'm going to divide it into 2 things. And one is basic nutrition, and the other is food sensitivities or allergies. So those are sort of 2 different approaches.
So maybe you can get started on the shorter one, because now we have about a minute and a half.
Okay. Well, basic nutrition just refers to how well kids eat their breakfast and lunch, and not giving them Pop-Tarts or white flour pancakes and syrup for breakfast, but giving good, low-glycemic, unprocessed carbohydrates with some protein and fat for breakfast, and the same for lunch.
Mm-hmm. So getting them off to a good start with just the basic good nutrition, which seems like we've really lost touch with in our culture, that everything is now very sugary for kids, and all of the TV ads for foods for kids are, foods that are either just very, very highly processed, or, we don't see commercials on TV for kids to eat their vegetables or eat fruit.
Right, exactly.
Welcome back to The Vital Life. We're here with Dr. Sanford Newmark talking about ADHD and how to treat it without drugs. I really encourage you, if you have a question for Dr. Newmark, to call in on the call-in line and ask a question, or to email us at vitalliferadio@gmail.com. I want to also thank our sponsors for this show, Douglas Laboratories, who make quality nutritional supplements available through your healthcare practitioner. So before the break, we were talking about the nutritional recommendations for kids with ADHD. And Dr. Newmark, you said there were 2 kind of areas. We talked a little bit about just general good food, and then there's a couple of other things that people need to know about nutrition.
Yeah, so what it turns out is that many children with ADHD have food sensitivities. That means that certain foods that they're eating can actually significantly hurt their behavior, significantly cause ADHD symptoms. Most often these aren't true food allergies. So if you went to an allergist and got a blood or skin test for allergies, they may not be positive. So that's why I use the word sensitivities. And these can be really common foods that are not necessarily not healthy. Foods like dairy or wheat or corn or soy can actually trigger children to behave in an ADHD manner, to be impulsive, to be hyperactive, to have difficulty concentrating. And when these foods are removed from the diet, you can see very significant changes. And this has actually been shown in a number of research studies. This is not new or just sort of alternative information. Just as an example, just in the last year, a study published in the Lancet, which is maybe the world's most prestigious medical journal, they took 100 kids and gave 50 of them a very restricted diet where they weren't eating any milk or wheat or dairy and a few other things, and had 50 other kids who were controls. And the children who went on this restricted diet, 70% of them had significant improvements in their ADHD. And as I said, this is not the first study to show this, but it sort of never really makes the popular medical literature. It's certainly because, well, my opinion is because nobody really stands to make any money out of this.
So if a parent is worried about that, how do they need to get a blood test for this, or what do you recommend? Well,
I don't always recommend a blood test unless some other symptoms make me think that the child has true allergies, kind of, asthma or chronic allergies or hives. I don't really even necessarily do a blood test for that, although I do a blood test for other things in ADHD. What I do is I have them do what I call an elimination diet, where they eliminate a number of these foods for a period of about 3 weeks, and they see what happens to the child. And after 3 weeks on this elimination diet, which I go over with them very carefully, and we go over the nutritional aspects, if there's no change, then you say, okay, in this child, food doesn't seem to make a difference. But if there is a big change, if the ADHD symptoms are significantly better, which I see on a regular basis, it's certainly not every kid with ADHD. Maybe, 25 to 40% of them will have some significant improvement.
And you noted in your book that sometimes there isn't a reaction to the food until it's reintroduced. Like They may not have a significant improvement. However, when they start back eating the dairy, then their ADHD symptoms may get worse.
Yeah, it's interesting how that happens. I think what happens is, you don't really notice the change so much until you add back the food, and then you really notice it. Mm-hmm. And when that happens, it's really a good thing to be able to just treat these children just by managing their diet. The other thing about food sensitivities is that kids with ADHD are often really sensitive to artificial colors, flavors, and preservatives. There's been a lot of research showing that they actually make normal people more hyperactive and ADHD people worse. And in fact, in Europe, for certain food colorings, there's actually a warning label that people have to put on. And it says, this may make your child hyperactive.
Oh, my goodness. And we don't have that here.
No, we don't. The FDA recently reviewed that, and they said, well, yes, food colorings can make kids more hyperactive, but we don't need a label.
That's a shame.
Yeah, it is. But it just shows how strong, at least the people in Europe, considered this evidence. So one really simple thing to do is to just try and avoid these artificial colors and flavors. A good example is Gatorade. Oh. Every Gatorade has, except the clear one, has artificial colors. And our kids are drinking this by the ton.
Even yogurt now is colored.
Right, even yogurt, Cheez-Its. People put these artificial flavors and colors into just so many things.
Mm-hmm. And those could be easily avoided, probably.
Yeah, they're pretty easily avoided. And, you can get the same things. Like you can get little cheese snack things that have natural color instead of artificial color. I often recommend, for instance, Trader Joe's. They often have substitutes, and rarely have artificial colors and flavors in their products.
Yeah, unfortunately, we don't have a Trader Joe's everywhere. I know in
No,
Denver
we don't.
I'm sure as a pediatrician, hear a lot about parents' fears that they can't get their children to eat a healthy diet. And there's a wonderful quote in your book from Ellen Satter, who is a leading feeding therapist, and she says to parents, your job is to offer your child the food you want to offer at the time you want him or her to eat it. The child's job is to decide what and how much of it to eat. I love that.
Isn't that great? It's really just one long sentence that explains the whole approach.
Yeah. But what do you do when a parent comes in and says, I can't get him to eat vegetables?
Right. And I say, you're right, you absolutely cannot get them to eat vegetables. But what you can do is not offer other things that you don't want them to eat.
But then my child's going to starve. Won't he be hungry?
Right, and they do say that sometimes, and I say 99.9% of children will eat plenty, even if you take away the foods that they usually like, even if you take away the junk foods. It may take a few days, it may take a week, but their hunger will take over.
Yeah, very few children will starve to death.
Yeah, I still haven't found that child who starved to death when on one of these diets. But what I emphasize is when children are young is when parents have the control. This is when they can really set the child's eating habits and doing it by example and what's available in the house. If there's no soda in the house, the child won't drink soda. If there's no junk food sweets, the child won't eat them. Now I don't like to be dogmatic. I don't think children should never have a soda or never have a treat. I mean, a certain amount of those are fine. But the general thing that children eat, like sugar cereals, is a really good example. Why keep Lucky Charms or Cocoa Puffs in the house? Mm-hmm. There's no reason a child should be eating them. So
I know some parents feel like they're depriving their children if they don't allow them to eat these kind of special, fun foods. They feel like, and their friends are eating it, so, why can't I? Right.
Well, I just think that having your child remain healthy is more important than worrying about, whether they're eating the same cereal as their friends. And again, you can always have one of these things for a treat. But
and a treat should be a treat, and that's something that is infrequent, not every day or 3 times a day.
Exactly. So when you offer your child breakfast, you can offer choices. Okay, you can have this healthful whole grain cereal, or you can have a piece of whole wheat bread with peanut butter and a glass of milk, or you can have some yogurt and fruit. And the child can pick. It's just that pancakes with syrup is not on that choice.
Yeah, and I think we teach our children what to eat from a very young age. So just as you say, it's best to start out as early as possible. Yeah. Okay, well, we have a few minutes before the next break, and I wanted to just ask you, because in the beginning we talked about how many children are being put on stimulants such as Ritalin. What's wrong with that? Why not give children, even if they are marginally diagnosed with ADHD, why not give them Ritalin?
Well, that's a good question, because Ritalin and its derivatives actually, quote, work in about 70% of the cases. In other words, that they actually cause the symptoms you're trying to treat to get better. So there's 2 reasons. One of them is that there's often significant side effects, and these side effects can range from really minor to slightly decreased appetite. But they can be more. They can have significantly decreased appetite and weight loss. They can impede growth. They can cause headaches, stomach aches, occasionally 1% of the time hallucinations. And then there's also children who don't have such obvious side effects, but I hear this from parents a fair amount where, yes, he's doing better, but he's just not as joyful, or she just doesn't have that spirit that she used to have. It can sort of decrease this kind of natural, ebullient, happy spirit that kids have. It doesn't happen all the time, but it does happen. And so that's something to watch out for. But even more important, we don't know what the long-term effects of giving children these psychostimulants for 5, 10, 15 years is going to be on their eventual development. We just don't know. We know it will cause changes in the way their brain develops. That's without a doubt. You can't change the neurotransmitters in a child's brain, which is what these stimulants do, on a daily basis for years and years and years without changing how the brain develops.
So it's interesting that we're doing essentially a large experiment on a huge number of kids by giving them the stimulants. Some of them are getting them very, very young, and yet we don't have the studies to show us what these long-term benefits are, is what you're saying. Exactly.
It's a sort of a large, uncontrolled experiment. And in the kids where it's obvious they really desperately need them, that there's a true diagnosis, a true significant need, well, then you say, okay, the what's happening to the child now is just worse than what some possible long-term effects are, and I understand that. But let's not just jump to treat the kids with the mild symptoms. We can work on the nutrition and certain supplements, which we haven't talked about first.
I'm here with Dr. Sanford Newmark, who is a pediatrician specializing in integrative and holistic treatment of children with autism and ADHD. He combines conventional medicine with nutrition, behavior management, and various complementary modalities. And he works now at the Osher Center for Integrative Medicine in San Francisco. So before the break, Dr. Newmark, we were talking about some of the alternative therapies, or we were talking about Ritalin and then segueing to what are some of the alternative therapies that you use in your practice to treat ADHD.
Right. So, it's funny. I use nutritional supplements a lot, which I don't really think should be called alternative, but compared to how most doctors operate, I guess it is. What we know is that certain kids with ADHD may be low in iron, zinc, and magnesium, and that all those minerals have been shown to be important in ADHD symptoms, and there have been studies showing that all of those minerals can improve children's symptoms. Iron was particularly dramatic in one study. Kids who had ADHD had average iron level of 22, and those without ADHD had an average iron level of about 44. And when those kids with the low iron were then treated, their ADHD symptoms improved significantly at the same amount that a medication might improve them. So this is really important things to check: iron, magnesium, and vitamin D, and zinc. And I will supplement those when I need to. There's also been a number of studies about omega-3 fatty acids, fish oil, and ADHD. I think a lot of people know that fish oil is very important for good brain function. And most people in our society are deficient in omega-3 fatty acids. And I always supplement the kids with ADHD with fish oil. It's good for their general health, and it's good for their ADHD.
Do you use cod liver oil, or do you use just...
I actually use a fish oil that's not a cod liver oil, although you can use cod liver oil. I don't think they need all that preformed vitamin A that comes in the cod liver oil. But either way is really okay.
And what about herbal remedies for ADHD?
Yeah, herbal remedies are a little sparser. There's one called pycnogenol that can be quite helpful, which is something that comes from a bark of a European pine tree. There's a herbal combination, an herb called valerian, which can, in combination with lemon balm, sort of calm kids down a little. And actually, I'll even use that for kids who are on medication or having kind of a rebound effect when the medication wears off. It's just calming, but doesn't necessarily help their concentration. And
what about some of the behavioral things?
Right, I'm really glad you asked that. I think how you behaviorally manage these kids is tremendously important. Many parents end up very frustrated, upset, angry with the behavior of their kids with ADHD, and it's no surprise. But they end up in a very negative interaction pattern with their child. And the ADHD child may end up just misbehaving just to get this kind of attention. The negative attention actually becomes a big part of how they get their reinforcement. And you wouldn't think they like negative attention, but to them it's better than no attention. And there's a wonderful system called the Nurtured Heart Approach. It's described in a book called Transforming the Difficult Child by Howard Glasser. That I love and have had tremendous success with in ADHD kids. So,
can you say a little bit more about that?
Yeah, in this approach, it's based on the idea that these kids have really inordinate needs for attention, and almost all the parents I talk to whose kids have ADHD just sort of nod and smile when I say that. And when these kids don't get their needs for attention met positively, they will just happily seek out negative attention. And that happens a lot with kids with ADHD because people are always giving them negative feedback. They're always being told, sit still, be quiet, why didn't you finish that, how come you didn't brush your teeth, where's your paper, or, get organized. And so in this approach, he kind of reverses it, where you give the children lots of positive feedback for the good things that they do. And then what you do is you have good rules and consequences, but you give those without energy. You give those without intensity and emotion and anger and lecturing. So the child is not getting your emotional energy for bad things, but for good things. And then there's a credit system.
So it could be something as simple as thank you for closing the door, or thank you for eating your dinner.
Some kids you have to start small because they're not doing that many things right. But it can have tremendous effects, really, and often quickly. So I think that's a big part of the approach. And the other part of the approach is to make sure the kid is getting the right school intervention. So many times I hear a history that sounds like, well, first grade was great, but then second grade was a complete disaster. And third grade went pretty well, but now it's fourth grade and things are a disaster again. Well, that's all about what's going on at the school, the fit between the teacher and the child. So it's very important to make sure the child's in the right school if you're lucky enough to have a choice, the right teacher if you're lucky enough to have the choice, and in at least the right interventions. Children who are diagnosed with ADHD have a right to a 504 plan, what it's called, which is reasonable interventions in the classroom. And it's
so what are some of the interventions that parents
Some of the interventions are sitting in the front of the class, not having to do 30 math problems that are all the same, but maybe just do 10 or 15 or being graded on them, being given a little extra time for tests, writing the homework down for them, whatever that particular child needs to help them succeed. And that's it's so important to make sure that those things are happening.
So just as we come to the end of the show, I wanted to kind of wrap it up with a question. If you are a parent whose child has or has not been diagnosed with ADHD, but you're suspicious or someone has told you that your child has ADHD, what are the steps that you should take to ensure that you get the right diagnosis and the right treatment?
Right. I think you need to find a medical professional who is experienced in dealing with ADHD. This can be a pediatrician or family practice doctor. It can be a developmental pediatrician, occasionally a neurologist, though they don't really like to do that stuff so much. Sometimes even a really good psychologist, though the psychologist would have to sort of be combined with some type of doctor and work together, since psychologists don't really do the medical part. And find somebody like that and make sure you get a good evaluation with learning disability testing if necessary. And then when that's all done, when the evaluation's all done, then you can decide, am I going to do nutritional interventions, behavioral intervention, what school interventions? And I think only the minority of cases need to be treated with medication immediately.
And it seems like even if they end up on medication, it doesn't do any harm to start with some of the nutritional therapies or the dietary supplements.
Absolutely. And in fact, there are some studies showing that, for instance, zinc, even if you're on medication, will decrease the amount of medication you need to use, which may make a big difference.
Yeah, that's huge. Well, any last-minute pieces of advice to our listeners who have children with ADHD?
Yes.
Not everybody can find someone like you, and
right,
I definitely want to recommend your book called ADHD Without Drugs. It's really well written and is full of information. But if you have any last-minute words, I'll...
Right. Well, just as we were saying, make sure you get a good evaluation and look at the non-medical, non-pharmaceutical ways of treating first. And also just always be aware that children with ADHD have many wonderful, good, and creative qualities, and that not everything, the goal of life is not to make every kid sit still in school and do the same work as everybody else. And sometimes these children are wonderfully creative and talented.
Well, that's excellent advice, and I assume people can get your book in most bookstores or online?
Yep, it's on Amazon. Some bookstores have it, but I would say probably online is the quickest and easiest way.
Okay, so I'm sorry to say, but that's all the time we have today. I wanted to thank my guest, Dr. Sanford Newmark, author of the book ADHD Without Drugs, and especially thank you, the listener of the Vital Life Radio, Awakening Your Full Potential. Until then, I wish you good health and vitality.
You have been listening to the Dr. Carolyn Coker-Ross Show. Please visit CarolynRossMD.com. That's CarolynRossMD.com to access podcasts, show archives, and more about Dr. Ross and her services.